So I'm going to speak in this few minutes about the innovative approaches to ensure accessible and equitable healthcare. In the beginning, I want to give some outlines about the accessible healthcare. What does it mean? And then we'll explore challenges. Also, we'll discuss some cutting edges approaches or innovative approaches to help us in make the accessible healthcare, and some case studies. So if you are going to speak about accessible healthcare, it is a fundamental human rights, and the innovative approaches have emerged to bridge the gap in accessibility to everyone, such as telemedicine, virtual healthcare, which Dr. Osama and Dr. Jihan, Prof. Osama and Dr. Jihan, they cover it in their presentations. Also about the community health workers, their role, we'll speak a little about them. Through mobile clinics, you can also make accessible healthcare to the patients, especially in underserved areas. Collaborative partnership, this is very important, and data-driven insights, this is very important also. So if we are going to speak about the challenges, current challenges available, there will be, we can summarize them on geographical barriers, socioeconomic disparities, and cultural differences. Then it came to the innovations, and using of technology to overcome this this challenge. We found that technology that enable remote consultation, connecting patients with healthcare professionals, and also allowing them to receive medical advice without the constraint of geographical distance through the telemedicine and virtual care, which was discussed by my colleagues in the previous two lectures. Then we can go also to a second solution, اللي هم المobile clinics and the outreach. Mobile clinics proven to be invaluable in these things. So these roving the healthcare units reach remote and underserved areas, also delivering not only the medical services, but also health education. And also the comprehensive approaches ensures that communities receive holistic care and health information. In this I can give an example from UAE. We have in each October, we have mobile units, mobile clinics going to the remote areas and available in the country for screening of breast cancer for a whole 1 month. And this is of a great value. Anybody who's screened and discovered that they got the cancer, they are, according to the government rule, they will treat them free in the country, even if they have insurance or they don't have insurance, as orders or as given from the higher authorities. Then we go to community healthcare workers, which play a big role also. They are a critical facet of accessible healthcare is the role of community healthcare workers in many communities, which will be these local individuals, they will be trained to provide healthcare services within their community. So how they will do it, they will make building a trust, cultural competence, and also understanding the local needs of in their areas, and also they are effectively overcome the barrier to care. It will be supervisors from the primary healthcare will supervise the process and the supply of some items also. Then they will cause them to go to the community and keep treat them or educate them or help them in any need according to their needs. If we go to see also to speak about the, sorry, I can go back. Previous slides. Yes, if we are going to also to speak about, we can speak about the innovative funding models. We can see the innovative funding models, it will play a big role also in making the healthcare accessible to all. It can be through micro insurance and crowdfunding are revolutionizing the healthcare financing. This is a very important point. And these models also provides avenues for individuals to contribute toward their health expenses and reducing financial barriers and making care more accessible to all. It causes like a lever, this figure, it will explain that levers that private and public stakeholders are employing to address issues and barriers in health and healthcare. It can be done through the collaboration of cross-industry collaboration with the digitalization and the big data AI also. These all with the global collaboration supporting the system, which can invent and create a policy and advocacy for certain things, and also innovative funding models. Also, it will enhance or establish public-private or strengthen the public-private partnerships to allow the patient empowerment and also targeted specific decentralization system. This is, I found it in LEK Consulting, the source. It is a word from the World Economic Forum. In UAE, we are providing insurance to more than 95%, either through the local, which they will be free through the free insurance for all the local in UAE, and the other who's working or expatriates, they will be under companies, insurance company. Most of them who's working in UAE, they will be under insurance company. For all of most, there is a big, we don't face any problem of health difficulty issue or are not accessible in UAE, according to the great insurance system available in our country. If we go to see also creating accessible healthcare require, as we said, collaborative efforts. It can be the public-private partnership, bring together governmental entities, private sector organization, and also non-governmental organization. All of them, they are helping and providing the proper or making it the healthcare accessible to the patients who need it. These collaboration also pooled resources and experts, leading to successful healthcare intervention. If we also empowering individuals with health education, we found that it is a cornerstone of equitable healthcare through either online platform, workshops, and community programs, which can promote health literacy, enable individuals to make informed decisions about their well-being, and also, as we discussed in the previous slide, community health workers, it seemed, from the education initiatives. If we look to the relationship between health and education, we found education can create opportunities for better health, and also the student health can impact on educational outcomes, and people, social, economic, and physical environment can affect both their health and their educational outcomes too. So if we're going also to think more deeply, we found that to be truly achieve equity, we must address the social determinant of health, which is economic status, education, healthcare, built environment, and social context. Factors such as housing, nutrition, education, and employment play a crucial role in health outcomes. By targeting this determinant, we can create more level playing field for health access. Also, culturally competent care is essential for ensuring equitable healthcare delivery, which is emerged from the cultural diversity to the knowledge to the sensitivity, culture sensitivity. So to reach this point, we have the healthcare providers must receive a training to understand and respect the cultural differences building trust, and also fostering better communication with patients from diverse background, which is happening, which is in the Gulf region. It's very clear. I have 2 case studies from Rwanda healthcare system, which Rwanda's post-genocide health transformation is a testament to innovation through community-based health insurance. The country achieved impressive health care coverage. Also, Rwanda experiences teaches us the power of community involvement and the government commitment. If we see the pyramid of it lies on the base that the community health worker services play a crucial role, and then it will help, then the health center care, then becoming district hospital services, and then in the top of the pyramid, the district health units and the leadership planning for this system. Also, a second example I will give you, which is Kerala Primary Healthcare. It is present another case study of equitable healthcare, which through their strategic governmental investment in education and in active community participation, Kerala achieved remarkable health indicators, which shows as example in the impact of comprehensive approaches. If we go also to the integration of artificial intelligence and predictive analytics, make a big transfer for healthcare through analyzing vast amount of data, and also can predict the health trends, and also optimize resources allocation and enhance diagnostic accuracy to ensure the health delivered where it needed most. Example of that, as Dr. Jihan explained it, the AI in diagnosis and personalized medicine. In drug discovery, we have it in big issue. Also, telemedicine, health monitoring, epidemic, outbreak, predictions, all these, they have a big effect. So we found that the integration of this, it make a big transforming in healthcare, especially also it happened enhance healthcare in UAE. By predicting disease outbreaks, also, and customize the treatment plan based on individual needs. AI-driven healthcare also solutions are instrumental in tailoring intervention to specific population, ensuring targeted care delivery that addresses health disparities. We found that by harnessing the power of AI, the UAE is advancing toward more equitable health outcomes for its diverse population, for revolutionize them. Also, we have geographical health care mapping in UAE through using technographical information system. It maps diseases, prevalence, healthcare facilities, distribution, and population density. This approach aids in resource allocation and ensuring also the healthcare services are distributed equitably. Geographical mapping, as we said, it enables efficient healthcare planning, enable also provision, accessible, and timing care for all segments of population. When we speak about also, it will come the ethical consideration as we innovate. The ethical consideration come to the forefront of everything. So we have to do balancing data privacy, and informed consent, and equitable distribution of resources is a paramount. So there should be a transparency on how AI tools make their decision in healthcare outcomes. And also the AI is prevalent in the advancement of healthcare, and maintaining the human element in care is essential. There's global health equity demand collaboration on international scales through some organizations like WHO, which lead the effort to ensure that the healthcare innovation are shared and implemented globally, transcend borders and benefiting every corner in the world. So for the future outlook, we found the future of healthcare is and ongoing innovations. So as we embraced emerging technologies like genomes and precision medicine, we can anticipate even greater strides in healthcare accessibility and equity. So in conclusion, we found that innovative approaches are paving the way for accessible and equitable, and by harnessing the power of telemedicine, community engagements, technology, education also, and collaboration, global collaboration, we can build a future where healthcare is not a privilege, but a fundamental right for every individual, irrespective of their circumstances. So here we are saying that through the universities and the educational bodies, we can educate to innovate more, and we can participate in this matter. Together, we can make the difference. Thank you very much. If you have any question, please.